Good day and welcome to a Greater Milwaukee Committee COVID-19 pandemic update. Thank you for joining us. I'm Dr. John Raymond, President and CEO of the Medical College of Wisconsin, and I'm a member of the Greater Milwaukee Committee. The data I'll present, the conclusions and advice are current as of July 15th, 2021. The COVID-19 pandemic is dynamic. And because COVID-19 is a shape-shifting virus, and because the science of COVID-19 continues to evolve, I advise our listeners to seek frequent updates. This first slide summarizes key points of the current state of the COVID-19 pandemic. In Wisconsin and in Milwaukee, daily case counts, hospitalizations, and deaths remain low compared to the three surges that we experienced in 2020. However, like in 46 other states, three early trends in Wisconsin have turned unfavorable. Case counts have more than doubled over the last 2 weeks. The percentage of positive COVID-19 tests has begun to rise, and the R number, a measure of contagiousness, has been greater than 1.0 for the last 3 weeks. Lagging indicators such as COVID-19 hospitalizations and deaths are stable in Wisconsin, but those indicators have taken an unfavorable turn in most of the rest of the United States. And I believe that those indicators are likely to turn unfavorable soon in Wisconsin due to three factors: the emergence of more contagious and dangerous Delta variant, the attenuating vaccine efforts, and relaxed personal mitigation measures. This next slide shows progress that we've made in Wisconsin since November 2020 by reducing the current burden of newly diagnosed COVID-19 cases in each of our 72 counties over the last 8 months. Starting on the left, it's apparent that the burden of disease was critically high in 65 Wisconsin counties last November, as shown in red, and very high in the 7 remaining dark blue counties. Now, as you shift your attention to the right, observe that the burden of disease progressively diminished through early July 2021. Now with most of our counties with a medium burden of disease and 18 with a low burden of disease, shown in the 2 lightest shades of blue. So clearly there's been progress to date, largely due to our vaccination successes. However, a closer examination of the most recent county level data shows some troubling trends that suggest our progress has stalled and is taking an unfavorable turn. This slide shows the progress that in 1 week from July 6th to July 13th, our favorable trends began to reverse at the county level. And this is visually apparent by the smaller number of counties in light blue and the growing number of counties in medium dark blue as you move from the left to the right. And we went from no counties with growing case activity to 13 counties with growing numbers in that short period of time. Additionally, Wisconsin case average activity increased from moderate to high across the entire state, and the trajectory of the pandemic, which had been stable since early June, increased by 128%. This next slide shows 4 screenshots from the Wisconsin DHS website that show our COVID-19 vaccination progress. The left-hand 2 panels show vaccination rates in Wisconsin, and the right-hand panel show vaccination rates in Milwaukee County. About 51% of Wisconsin citizens have received at least 1 dose of vaccine, as you can see on the upper left, and 49% have been fully vaccinated. In terms of adults, in other words, individuals 18 and older, about 62% of Wisconsinites have received at least 1 dose, and 59% have completed the series, falling short of President Biden's goal of 70% of US adults to be vaccinated by Independence Day. However, we are currently the best of 33 states and territories that have not yet reached the 70% goal. Moving to the right, Milwaukee County shows similar numbers. Now, we're still lagging slightly behind the rest of Wisconsin, but are steadily closing the gap through focused efforts of groups such as the Greater Milwaukee Committee, the MMAC, Jump at the Sun, our public health departments, and various coalitions of healthcare, governmental, and community groups who are working hard to address vaccine confidence. This next slide summarizes key data about worldwide vaccinations, where we stand as a country relative to the rest of the world, and where we stand in Wisconsin compared to other states and territories. More than 3.5 billion COVID-19 vaccine doses have been administered worldwide. And the US is second in the world to the People's Republic of China for total vaccinations. And we've administered 336 million vaccine doses here in the US. The US has a higher percentage of individuals who completed their series of COVID-19 vaccinations compared to most of the rest of the world, but we are behind 13 countries listed in the second bullet. And relatively speaking, however, US vaccinations have lagged significantly compared to other countries over the last 2 months. And I expect that Canada will surpass us within the next few weeks as a percentage of population which has been fully vaccinated. Now, within the United States, Wisconsin's 20th of 56 states and territories in terms of fully vaccinated individuals. But over the last 2 months, we have progressively fallen back from our previously leading position as a top 10 state. In terms of our neighbors, Minnesota and Illinois have surpassed us, although we do remain slightly ahead of Michigan and Iowa. The next slide lists key takeaways about the pandemic in the US. We have made significant progress against COVID-19 in our country, but progress has stalled and is reversing due to the Delta variant and a slowdown in vaccinations in the US. Our 7-day average of new cases in the US has increased by 111% over the last 2 weeks. Hospitalizations in the US have risen by 22% over the last 2 weeks. And most troubling, the US 7-day average of daily deaths has increased by 5% over the last 2 weeks. The unfavorable trends are most apparent in counties and states with relatively low vaccination rates. In fact, counties and states with vaccination rates that are better than average have 3 times fewer cases than counties and states that are lagging in terms of vaccinations compared to the average. And for example, in Missouri and Arkansas, and also across Florida and Los Angeles, they're seeing significant surges. Now, the US is at 49% of the population fully vaccinated. It's about 160 million individuals and 56% of 12 and older who are eligible. 184 million individuals have received at least 1 dose. The vaccinations are declining very significantly, but we're inching forward. And in the US, unlike most of the rest of the world, vaccine supply greatly exceeds the demand. And as a country, however, we fell short of the hopeful target of vaccinating 70% of our 18+ individuals by July 4th, although 23 states did reach that 70% goal. Daily vaccinations in the US have dropped off significantly. They're down 90% to about 530,000 per day compared to a peak of about 3.4 million on April 13th. This next slide highlights the new World Health Organization nomenclature for COVID-19 variants. And there are 3 levels of recognized variants that are shown in the green bar on the right. Variants of interest have specific markers predicted to impact the biology, but for which there's not yet adequate evidence to suggest that there's been a documented change in the essential characteristics or behavior of the virus in populations. And the CDC is tracking the 7 variants highlighted in blue at the bottom of the slide as variants of interest. And those include epsilon, zeta, eta, theta, iota, kappa, and lambda, the characteristics of which are highlighted on this slide. In contrast, at the moment, WHO only recognizes 4 of those as variants of interest, and those are depicted by the asterisks. Probably more importantly are variants of concern, which show clear evidence of increased transmission or virulence, or some degree of escape from immunity. And the WHO and the CDC both recognize 4 variants of concern at this time. And those are termed alpha, beta, gamma, and delta. And those are shown in the purple text. And the B117 is the UK variant, that's alpha. Beta is the B1351 variant spotted in South Africa. Gamma is the P1 variant first spotted in Brazil. And Delta, which is the one that's surging now in the US, is the B1.617.2 variant originally spotted in India. Now, the final category encompasses variants of consequence, for which there would be clear evidence that prevention or treatment measures are ineffective. And fortunately, there are no such variants at this time. But unabated spread throughout many countries in the Southern Hemisphere and equatorial zones of our planet could, in theory, give rise to such a variant of consequence. This slide shows key points about the COVID-19 Delta variant. Delta is the most transmissible or contagious variant identified thus far. It's twice as infectious as the Alpha or Beta variants, and it can be spread very easily by asymptomatic individuals. The R value for Delta is estimated to be 40 to 80% higher than COVID strains that were circulating in 2020. And the primary symptoms of Delta seem to be different than other strains. And these are headache, sneezing, runny nose, or sore throat, different from earlier variants, and certainly highly concerning due to the potential for confusion with allergy or common cold symptoms. Delta also appears to cause more severe disease with more rapid onset than earlier variants. And we know that the likelihood of hospitalization for Delta is significantly increased. And based on what's happening right now in Missouri, might be of particular concern for people in their 20s, 30s, and 40s, many of whom now are hospitalized and are requiring intensive care unit and ventilator support care. We also know that Delta infects younger, unvaccinated people than many of the other strains that have been reported previously. And so the common wisdom that COVID-19 largely causes asymptomatic mild disease in young people really needs to be re-examined, because that does not appear to be the case with Delta. Delta also has shown partial escape from vaccine immunity, and this is why the CDC and the FDA strongly recommend that people should complete the full course of mRNA vaccines to achieve 90% protection. One shot simply isn't going to give adequate protection from Delta. And Delta now comprises over half of the newly reported cases in the US. And as of today, only 83 cases have been detected in Wisconsin, but we do expect over the next several weeks that Delta will be the predominant strain. This slide and the next two slides cover some unresolved issues relevant to COVID-19 that really warrant our urgent attention. And these are posed as questions. First, should fully vaccinated individuals continue to wear masks? And we know that the WHO has recommended continuing wearing masks, whereas the CDC has given different recommendations for fully vaccinated individuals. I expect that the CDC might reevaluate that recommendation as Delta begins to surge across the country, and that many public health officials already are recommending that even fully vaccinated individuals should consider wearing masks when in crowded indoor situations. The next question is, should children wear masks when returning to school this autumn? Current CDC guidance says that vaccinated students and teachers do not need to wear masks. Again, this is a recommendation that is subject to revision in terms of following what Delta does going forward. There also are many potential problems with this bifurcated approach, which would recommend continuing mask wearing for unvaccinated students and teachers. And this is especially apparent in middle school, where some but not all students are currently eligible for COVID-19 vaccination, and where the vaccination status of students and teachers might not be known to parents and teachers. So problems include potential stigmatization and bullying, privacy concerns, and difficulty knowing which students and teachers have been vaccinated. Another really important question is, will Delta cause another surge in the USA? I think the answer is yes. The real question is, how significant will that surge be? And this is very important because we know that 99+% of COVID-19 deaths in the USA since in January have been in unvaccinated individuals, and the vast majority, approaching 99%, of hospitalized patients with COVID-19 as of today are people who have not been vaccinated. The next question is, what do we know about the new Lambda variant, which was first described in Purdue and seems to be gaining a foothold in the Americas, especially South America, and in some communities in Europe? At this time, there's insufficient data to designate Lambda as a variant of concern, but Lambda does appear to be one that is very likely to be designated a variant of concern as we move forward. I also would note that Lambda also appears to be the first member of a new lineage, the C lineage or family of COVID-19 viruses. We can go to the next slide, thank you. This slide poses two questions. Will the USA recommend a booster for people who've been fully vaccinated against COVID-19 with either the mRNA vaccines, Moderna and Pfizer, or the J&J vaccine? Really don't know the answer to that question yet, but we do know that Pfizer will apply for EUA for the third dose, and Moderna is very likely to follow shortly thereafter. But there simply is not sufficient data at this time to make an objective assessment about either the need and the efficacy or the safety of a third dose. But we expect that this will be an issue that will be explored more fully over the next month or two. And the other question is, will other countries recommend a booster dose? Now, we're very fortunate in the US that the vaccines that have been distributed here are highly effective. And that's not necessarily the case for all the vaccines that have been distributed throughout the world. 53 countries have ordered and or administered Chinese vaccine doses. And the most widely distributed Chinese vaccines are based on very old technology of inactivated virus particles. And the Sinovac and Sinopharm vaccines have been shown to be much weaker than other COVID-19 vaccines, especially against the Delta variant. And some countries have already decided to administer a third dose, either of the same vaccine, that would be Sinovac or Sinopharm, or to cross-vaccinate with viral vector, AstraZeneca, or mRNA vaccines like Moderna and Pfizer vaccines. And examples of countries that have already made that decision include the People's Republic of China, United Arab Emirates, Bahrain, Indonesia, Vietnam, and Thailand. And interestingly enough, we know that Israel has already recommended administration of a third dose of Pfizer vaccine to individuals who are at risk. This slide poses a final unresolved issue, which is, what will the impact of Delta be in Wisconsin? And as I mentioned, currently there's relatively low penetration of Delta in Wisconsin, but it is rising. And we expect that Delta will be the predominant COVID-19 variant in Wisconsin by summer's end, possibly within just a few weeks. And if vaccinations continue to be stalled here in the state, our worst case scenario would be that we would have a surge similar to Missouri, which now has hospitals and ICUs full of severely ill, mostly young, unvaccinated people who are suffering from COVID-19. And in particular, rural serving hospitals in and around Springfield, and also around Branson, which is a resort community, are concerned about being overwhelmed and have requested assistance from federal rapid medical response teams. If we continue to make some progress with vaccinations, the best case scenario would be what is happening now in Israel, where we are seeing that fully vaccinated teachers are being infected by unvaccinated students, and where younger unvaccinated people are becoming symptomatically infected. But unlike in Missouri, at least as of yet, without full hospitals or ICUs, but that situation warrants continuous monitoring. And then a final point that I want to make is that our personal decisions that we make about mitigation measures, like distancing or wearing masks, or limiting our interactions with people in crowded or indoor spaces, will impact the progression of COVID-19 in Wisconsin going forward. And the final two slides are provided for your reference about the comparative efficacy and characteristics of the 7 most widely distributed COVID-19 vaccines in the world, shown in this slide, and then the next slide about the relative risks and benefits of COVID-19 vaccines and myocarditis, as well as acknowledging several other potential rare but significant side effects of the currently marketed vaccines in the US. And with that, I'd like to again thank you for your attention, thank the Greater Milwaukee Committee for its leadership in providing the opportunity for me to talk and to update everyone on the status of the COVID-19 pandemic. Thank you and have a great day.